Hello everyone, welcome to my YouTube channel. Today I am going to talk about hyperplasia versus hypertrophy. If you are being asked in Viva, what is the difference between hyperplasia, example in condition benign prostatic hyperplasia, versus hypertrophy, example in cardiac hypertrophy, how would you answer this question? Before we start, there is always a disclaimer, and the disclaimer is the same in all my videos. Thank you. Now let's begin. As an introduction, before we start, regarding the difference between hyperplasia and hypertrophy, I want to quote regarding what Isaac and Coffey 1989 said. In a given organ, the number of cells and thus the volume of the organ is dependent on the equilibrium between the cell proliferation and cell death. An organ can enlarge not only by an increase in cell proliferation, but also by a decrease in cell death. Regarding hyperplasia and hypertrophy, both are two related terms that occur together or that can coexist with each other. Both causes an enlargement of an organ or tissue. But remember, they are not similar in nature. Both can be caused by A. An increase in functional demand, B. Hormonal influence, but they do have a basic difference. Now, regarding the difference, 1. The definition itself is different. Hyperplasia is defined as cells in an organ or tissue increase in number, but the size of the cells remain unchanged or the same. For hypertrophy, it is defined as cells in an organ or tissue increase in size, but the number of cells remain unchanged or the same. Number 2. The difference regarding the cells that involve or that are being affected. In hyperplasia, it occurs in cells that are capable of synthesizing DNA and undergoing mitotic activity. Important to note that only cells that can divide will undergo hyperplasia, labile cells, and therefore hyperplasia of the myocytes in the heart and neurons in the brain does not occur. For hypertrophy, the cells affected involve both cells that are capable of dividing and non-dividing cells. Number 3. The difference is regarding the types. The types can be divided either due to physiological types or pathological types. In hyperplasia, for A physiological type, mostly due to normal stressor, it can be divided into 1 hormonal, 2 compensatory type. For hormonal types or causes, the examples are 1. Due to hyperplasia of breast at puberty, during lactation, and pregnancy. Number 2. Hyperplasia of prostate in an old age male. Number 3. Hyperplasia of pregnant uterus. Number 4. Proliferative endometrium after menstruation due to estrogen stimulation. In number 2, compensatory causes, hyperplasia can occur when a part of an organ or the contralateral organ in case of pet organ is removed. Example are 1. Regeneration of liver following partial hepatectomy. 2. Hyperplasia of one other kidney following nephrectomy on one side. 3. Regeneration of epidermis after skin abrasion. In regarding the type of hyperplasia that is pathological in nature, It occurs due to abnormal stressor. There are significant abnormalities in the organization and cytomorphology. There is a change in the intrinsic cells control that produces a subpopulation of cells that is less subject to normal tissue regulatory mechanism. This is a result from excessive hormonal stimulation of the target cells. The example are 1. Growth of adrenal glands due to production of ACTH, adrenocorticotropic hormone, by a pituitary adenoma. 2. Endometrial hyperplasia due to prolonged estrogen stimulation. Number 3. Benign prostatic hyperplasia. Number 4. Hyperplasia of thyroid in thyrotoxicosis. Regarding benign prostatic hyperplasia, BPH, it is an enlargement of the prostate due to hyperplasia of the epithelial and stromal cells, compromising the prostate. Such hyperplasia cause the formation of discrete nodules on the prostate, which can eventually obstruct the bladder, causing complications such as bladder stone, hydronephrosis, and frequent UTI, urinary tract infection. Increased levels of testosterone and its metabolites play a role of induction of hyperplasia of the prostate. For hyperplasia due to pathological cause, apart from excessive hormonal stimulation, another cause is due to irritation. Examples are 1. Hyperplasia of lymphoid tissue in infections. Number 2. Intraductal epithelial hyperplasia in fibrocystic changes in breast. Number 3. Epidermal hyperplasia. Examples are skin warts due to HPV, human papilloma virus infection, pseudocarcinomatous hyperplasia at the margin of non-healing ulcer. Okay, we already finished regarding the types that involve in hyperplasia. Now regarding the types that involve in hypertrophy. For A, physiological types, it occurs due to normal stressor, example in enlargement of skeletal muscles with exercise or increased muscle mass in bodybuilders. Another one is enlargement in the size of uterus in pregnancy. For B, pathological types in hypertrophy condition. 1. It is due to adaptive causes, example, hypertrophy of the cardiac, smooth and skeletal muscle. As an example given earlier on, in cardiac hypertrophy, there is a thickening of the heart muscle, myocardium, which results in a decrease in the size of the chamber of the heart, including the left and right ventricles. Among the causes of cardiac hypertrophy is due to high blood pressure, BP, or we call it hypertension. In B, pathological type of hypertrophy, number 2 is a compensatory reason. There will be a hypertrophy of compensatory organ on removal of the contralateral organ. Nephrectomy of one kidney causes hypertrophy of the other. Regarding the difference between hyperplasia versus hypertrophy, number 4, morphology difference. In hyperplasia, there will be an increase in cell number with increased number of mitotic figures. In hypertrophy, there will be an increase in cell size with nucleomegaly. Both hyperplasia and hypertrophy results in an increase in organ size, whereby both cannot be distinguished grossly. Microscopic examination is required to distinguish the two. For number 5, electron microscopy difference. For hyperplasia, there will be an increase in the DNA and typical mitosis. For hypertrophy, there will be an increased number of organelles, an increased synthesis of DNA, RNA, and myofilaments. And finally, number 6, outcome. The difference regarding hyperplasia versus hypertrophy. In hyperplasia, the outcome is the cells will regress after removal of stimulus. But in case of neoplastic transformation, it will not regress. In hypertrophy, the outcome is there will be the increase of the size of the cells is reversible on withdrawal of stimulus. Okay, I want to do a summary regarding the difference between hyperplasia versus hypertrophy. The difference can be summarized as 1. The definition itself. Number 2. The cells that involved or affected. Number 3. The types, either physiological types or pathological types. Number 4. Morphology difference. Number 5. Electron microscopic difference. And lastly, number 6. The outcome. Okay, that's all for today. I hope you have learned something from this video. Till we meet again, see you and bye.